Dan Foster's 15-point plan to improving mental health services in the UK. So let's take a look at point 1, changing mental health into brain health. So brain health sounds so much more positive than mental health, don't you think? It focuses the sufferer on the problem in hand, which is to get their brain back to being happy and healthy. It's also great for early years. They can get on board with what it means, they can understand it, and carry on talking about it all the way through to adulthood. Also, if you're going for a yearly check, it sounds so much more positive, doesn't it? Going for a yearly brain health check than what it does going for a mental health check, when everyone turns around to you and says, "Why, what's up with you?" Free mental health first aid training for everybody in the UK. So that's for non-sufferers, but most importantly, it's for sufferers as well. Doctors will be encouraging sufferers to attend mental health first aid training right up and down the UK, and that's important for my cost-saving plans. Yes, the launch of the Brain Health UK Digi Helpline. The helpline is all about getting information about improving your brain health and keeping it happy and healthy, but also it gives you access to trained counsellors who are equipped and know exactly how to deal with an escalating mental health crisis in the UK. And that's 24/7, and it's available not just on the telephone, but across all major digital platforms. Mental health first aid training for every UK police officer and paramedic. That means when the police officer or the paramedic arrives at the scene, they're able to recognise that the person is going through a mental health crisis and able to action accordingly. This means that they could potentially stop the situation from escalating and avoiding having to take the sufferer to that expensive hospital bed, which currently happens and is costing us millions in wasted taxpayers' money that could be better spent elsewhere, like on prevention and clean-up strategies that we're going to talk about in a moment. 5 mindfulness minutes from your favourite social media. So yes, you heard it right, that's 5 mindfulness minutes, which are distributed by a different social platform on a different day. So for example, it might be Twitter on a Tuesday that sends you a link through to a short video to practice 5 minutes of mindfulness. Then on a Wednesday you might get an update from Snapchat. Thursday you might get it from Facebook. This means that we covered the biggest, broadest spectrum of people, and everybody gets access to mindfulness at least once or twice a week. Daily brain health exercises to form part of everyday schooling. This is particularly good for children who have had their dinner, gone out to play football, and have just had the bell ring to tell them to come back for afternoon classes. It refocuses and helps them concentrate in afternoon classes, and also the intention is to help with early years exam stress. In fact, any year's exam stress when going through school. Labelling all foods that are good for brain health. So that is labelling all brain healthy foods in the UK with info labels, which don't just tell you that it's brain healthy, but also tells you why it's brain healthy. Reimagining mental health hospitals. Those drab and gloomy mental health hospitals finally get the makeover they deserve, with lots of Zen thinking and Zen designs. And also the canteens finally get the food that they deserve too, with food that nourishes the brain. Mental health hospital staff to spend more time with patients. A motivating staff pay review for mental health nurses, and a review of their jobs to include more one-to-one time with mental health sufferers in mental health hospitals to ensure that the care plan is the very best and most detailed that it can be when they leave that mental hospital. A lean approach to mental health hospitals. Reduce the amount of returning patients to mental hospitals using lean thinking, which identifies the root cause of a problem and comes up with solutions.
A reduction in waiting lists for talking therapies.
A significant reduction from 7 weeks to 3 weeks to wait for talking therapies, and a promise that you'll have a crisis counsellor who will remain in touch with you during those 3 weeks until a therapist is found.
Getting us off antidepressants faster.
A reduction in the time that people are on antidepressants. Before a new patient now gets antidepressants, there needs to be a timetable and a plan in place for weaning that person off the antidepressants until they're completely free of them, and reviewing it regularly with their doctor.
Home-based services do more for patients. Much more.
The home-based services team are hands-on anyway, so they work more closely with patients moving forward. They've got more opportunity to do more things with the patient, so they can design and develop plans to help the patient keep a happy and healthy brain, and to do it in a way that completely fits around their lifestyle.
The Brain Health UK 2020 tour
is a prevention strategy. So it's about touring all around the UK, giving lots of brain healthy information to as many people as possible. We'll be particularly targeting hard to reach areas and the LGBT communities.
Match and mentor with the gay and trans community.
This is all about finding the role models out there to work with the next generation to talk about pretty much anything every 2 weeks when they meet for a coffee. But the main point is to keep brains happy and healthy.
Let me know what you think.
So they're my 15 points to improving brain health in the UK. Do let me know what you think of them. Add your comments below and I do get back to every single person. Thank you.
So thanks for watching, and there'll be more of these videos to follow.